Hello everyone, I am Neha Kangralkar and I am an assistant professor at Department of Clinical Psychology, Yenepoya School of Allied Health Sciences. Today I'll be talking to you about basic rapport building skills, and this lecture is especially for people who are early career counselors and also who just work in clinical settings. So I think this will be a great lecture for people who are beginners especially. Okay, the specific learning objectives are that viewers will be able to list and apply attending behaviors and non-directive listening behaviors in therapeutic settings. They will be able to establish and strengthen rapport with client, and lastly they will be able to modify listening skills to fit male and female clients and clients from different cultural backgrounds. So before we jump into the definition of what rapport building means, I think it's important to understand why do we need to build rapport in the first place and what role does rapport play in a therapeutic relationship. So rapport is a very important component of therapeutic relationship. It actually determines how much of a working relationship has been established between the client and the therapist, and the kind of information that can come in from the client. So it is a crucial aspect of a therapeutic relationship and working relationship in therapy especially. So if we are going by definition, rapport is defined as harmonious interaction between the therapist and client that contributes to the therapeutic process, and rapport is integral in establishing a therapeutic relationship. What we need to understand is that rapport is not something that can be built in just 1 or 2 hours. True rapport or good rapport takes time, but what we can do is that we can start the process of rapport building from the very first meeting, and the rapport building process in itself starts the moment the client enters through the therapist door. So let's jump into some techniques and some behaviors that we can inculcate in our day-to-day counseling setup in order to build effective rapport. Alright, so rapport building skill sets can be divided into attending behaviors and into non-directive listening behaviors. Today we will be covering the basics, so hence the attending behaviors and non-directive listening behaviors will be the only aspects that we will be covering. When it comes to attending behaviors, these are mostly defined as the non-verbal behaviors that we display or the non-verbal cues that we give. So this can further be divided into positive attending behaviors and negative attending behaviors. So when it comes to positive attending behaviors, it can be categorized into 4 important stages, and as per Ivy and Ivy, it has been divided into 4 stages. First one called as the visual eye contact, second is the vocal qualities, third is the verbal tracking, and fourth is your body language or how you attend to them physically. So let's get into each one of these and what do they mean or what do they entail in terms of attending behaviors. So when it comes to positive attending behaviors, the first one is visual or eye contact. So eye contact, how much to maintain, how firmly to maintain can vary from culture to culture. It is important for us to keep in mind with the kind of population that we're dealing, what is their cultural background and how much eye contact needs to be maintained. So in Western cultures or in European countries, usually firm and sustained eye contact is appreciated, but when it comes to developing countries or countries which such as India for example, long-standing eye contact or a very firm eye contact might not always be appreciated, especially in rural settings, and it can make the client feel uncomfortable. So that is something that we need to keep in mind, what is our client's cultural background, and based on that we can determine how much eye contact to maintain. So eye contact can determine whether a person is confident or shy, but it's important to understand that every time the client is not making eye contact does not equate to them not being confident. So that is something to remember. Apart from that, it's also important to understand that when we are seated with our client and when we are in discussion, it's important that we maintain eye contact when we are talking, and when they are talking, it's not as much needed to completely focus on them, or you can vary the eye contact. So you can keep varying the eye contact in that sense. But of course, don't look around and minimize the movements so that they don't feel like you are distracted, or you are just not paying attention at all. So it's important to have the right amount of eye contact. Especially with clients of different gender, it's important to remember that too much eye contact can make them uncomfortable, especially in countries like India. So it's important to not get into that zone where you can make them uncomfortable. Alright, so next is vocal qualities. Now here we focus on the tone or the pace at which you're talking. We can also focus on the pitch of your voice. So all of these things matter. You can make a client pace by you yourself pacing your tone, basically speaking fast, or getting the clients to get to the point sooner, especially if they are someone who keep on getting distracted or keep on getting lost in details. So your voice qualities can make that happen, and that's why it's important for you to be self-aware as to how your voice qualities affect your client and other people around you. So when it comes to vocal qualities, you can also slow down your speech, lower your tone if you want the client to speak or explore about certain issue. You can use pauses as well in between in order to get their attention on certain issues. So in this manner, by varying your vocal qualities, you can go ahead and explore various issues and also pace or ask the clients to slow down. Now third is verbal tracking. Now this is quite an important skill set. It can be very difficult to do it, especially if you're an early career therapist. What we need to remember is that verbal tracking basically means you are tracking whatever the client is saying. So you're tracking the content of what your client is saying, and in this process what can happen is that you can get lost in the detail, because some clients are very talkative. So you can get lost in the detail to a point where you don't know how to track what. So when you're using verbal tracking, just remember that you need to track the important aspects that you want the session to go in direction of. So you can start verbal tracking by noticing the important themes and then only choosing to track those in order to get your client to move into that direction of exploration. Now next one that we have is body language, which is one of the important aspects. Now your body language can show the client if you're interested or not interested. So it's important to maintain a certain posture when you are in therapy setting. One of the important aspects is not to have a closed off body language, such as sitting with your legs crossed or leaning above your waist. If you're leaning in the backward direction, that can give a specific image of you not being interested to the client. So it's important to not do that, and also it's important to not sit in a very rigid manner that can make the client feel uncomfortable. So it's important to maintain basically a relaxed and calm posture with your hands probably in this sort of manner, and you can also sit in a position wherein you are slightly diagonal to the client, so that can also facilitate rapport and that can also get the client to talk more. So some other aspects are matching your facial expression to your feeling or the client's feeling, or sitting approximately to one arm length from the client. So these are all important aspects to take into consideration. What's also important is there is a technique called as mirroring. So essentially we do this in our day-to-day life. Whenever somebody is talking to us, we tend to have a kind of expression or response that is compatible or similar to what they're saying. So when it comes to mirroring, if you are doing it, you need to make sure you're doing it naturally and it's not coming off as animate, or it's not coming off as if you're mocking them. So it's important to use this technique carefully. Now, some things that we are supposed to avoid in terms of attending behaviors are these behaviors. So, some of these are negative attending behaviors which have been listed out, such as repetitive head nods. So, constantly repeating your head nods can be irritating to the client. Constantly saying which we tend to sometimes say, repeating it too often can again just distract the client or irritate them. Too much eye contact is again important, and then repeating sometimes some therapists or some of us might think that repeating their last words can give them a sense that we're understanding them, but actually just repeating the last words can come off as if you're mocking them, or come off as too unnatural in that sense. So last is mirroring inappropriately. It's important to know that mirroring is a technique that needs to come more naturally, or at least needs to look more natural. If you're doing it too forcefully, it might look as if you're mocking your client. Now next, what we're moving on to is non-directive listening skills. These are slightly more advanced than your attending behaviors and would require verbal expression. So the first skill set is the paraphrase. So paraphrase involves restating or rewording another person's verbal communication. But now it's important to remember that we don't parrot back exactly what our clients are saying. So when we are paraphrasing or restating, it's important to restate those sentences or that specific content which is relevant and important. So it's also in one way called as reflection of content. So you need to reflect on the aspects that are necessary when you're paraphrasing. So this is one example that I came across and thought it would be useful to refer to. So first one is the client and next is the therapist, is their conversation. So the client is saying that yesterday was my day off. I just sat around the house doing nothing. I had some errands to run, but I couldn't seem to make myself get up off the couch and do them. So to this, the therapist has paraphrased by saying, you had trouble getting going on your day off. So this is a very simple paraphrase that the therapist has used, and this is an example of how the paraphrase works. There are different forms of paraphrases that can be used, such as you can use a metaphor to paraphrase. You can also use a paraphrase where you're using to reflect on their feelings or how they are expressing or feeling themselves, because some of the clients use words such as I feel or I see or I hear. So you can tap into their senses by using a more sensory based paraphrase. Yes, so some of the examples here of the ones that I mentioned right now are, so it feels like you're stuck in a house with no doors and windows. So the first one, that is this one, is an example of a metaphor or a metaphor that we can use as paraphrase. The second one talks about the sensory paraphrase, such as use terms such as I feel, it looks like, it sounds like. So by saying this, you are tapping into your client's language and also in their sensory aspects. Now the next one is clarification. Clarification, the way it sounds, is very self-explanatory as a term. It basically means it is used to restate what the client has stated or to clarify what the client has said. So it can also be used to clarify what the client says. So one thing that is important to understand here is that clarification can be a tool to also show your client that you've heard what they've said. So let's say that your client has said something and you restate that sentence to them or that section to them and then ask them, is this what you meant? So when you're doing that, you're making the client feel like you've heard them, you're restating, and you're also using clarification to ask them if whatever you've understood is right. You're giving the client the autonomy to accept or reject what you're saying. Now next we have reflection of feeling. So this helps the client know that you are tuned into their emotional state. So when we are reflecting onto their feelings, what we are doing is we are getting the client's attention to the feelings aspect of whatever they're going through. Many a times clients tend to get lost in the detail. They might not know how to focus on their feelings or to ask themselves what they're going through right now. So what we can instead do here is through this particular technique we can get the clients to reflect on it. We'll see an example to understand it better. So over here, like we're saying that whenever we are reflecting on someone's feeling, you can start with something like I sense your feeling or sounds like you feel, and then you can go ahead and use a label. So this is how we usually phrase our reflection of feelings. So this example will tell us better as to what reflection of feelings would look like. So the client is saying the teacher pissed me off big time when she accused me of stealing her watch. I want to punch her lights out. So clearly in this statement it is evident that the client is angry, the client is extremely pissed, and so the counselor to that is replying, seems like you were a little irritated about that. Is that right? So to this the client is saying that irritated, hell I was pissed. So now the counselor is again stating, saying you were more than irritated, you were pissed. So if you notice, initially the client is starting off by narrating what the client has been made to feel, or what this particular faculty has done, or what this client wants to do as a retaliation. But there is not much mention of how exactly the client is feeling, or there's not much focus on working through it. So what the therapist is doing here is that by saying this, they are actually getting clients' attention to their feelings, saying that seems like you were a little irritated about that. Is that right? So yeah, that is what is happening, that the therapist is reflecting on the client's feelings. And if you see, as a response, the client is now accepting this reflection and saying that yes, this is what I felt, but it's not just this, I was really pissed. So he is again going on to explain how he's exactly feeling accurately. Alright, so now coming to the last skill set is summarization. So far a lot of these skill sets that we learned were something that we used as and when we are conversing. Summarization is a skill set that we might not use as often as when we are using restating or attending behaviors, but it's used intermittently during the session, or it's used towards the end of the session. So the idea of giving a summary or coming up with a summary collaboratively with your client is in order to make the client feel like you're paying attention to them, you've heard the details. And another purpose of it, as a therapist, the summary could really help you point out to your client the important aspects, because maybe your client is talking about something for about 30 minutes, but they have got so hung up on the details, or they've got so lost in the details that they're not seeing the pattern, they're not seeing the bigger idea or the points. So in this case, as a therapist, summary is your technique through which you can show them the broader picture. So summarization demonstrates accurate listening. It shows the client that you have paid attention, and it helps the client focus on important issues. It can be used in terms intermittently throughout the session and also towards the end. So these are my references. Coming to conclusion, all of these techniques can be used to build effective rapport with the client, and there are more techniques, however these are great techniques to begin with as an early career counselor. Thank you.